Bismillahirrahmanirrahim. This is the continuation of GIT diseases. In this session, we will learn about the most common diseases which happens in the uh, small and large intestine. First of all, the cold cystitis. Sometimes we can call it cholecystitis or cholecystitis. If we go to the word cystitis mean the inflammation of bladder. Cystitis just mean the inflammation of urinary bladder cystitis. But if there is the word cholecystitis mean the inflammation of gallbladder. Only cystitis mean the inflammation of urinary bladder, while the cholecystitis mean the inflammation of gallbladder. The inflammation of gallbladder take place due to some bacteria, due to some irritant, or due to some other factors. But the cholecystitis may also take place due to the presence of gallstone. But cholecystitis is just the inflammation of gallbladder. Cholelithiasis. Cholelithiasis is the presence of stone inside the gallbladder. The presence of stone inside the gallbladder, that is called cholelithiasis, or the cholelithiasis is also called the gallstone. Cholecystitis. Cholelithiasis is the presence of stone inside the gallbladder. If there is the word nephrolithiasis, nephrolithiasis is the presence of stone inside the kidney. Kidney stone is called nephrolithiasis, and the gallstone is called cholelithiasis. The cholelithiasis usually happen due to the hyper cholesterolemia, or the increased cholesterol level inside the blood. Some other factors are also responsible, but the increased cholesterol level leads to the formation of cholelithiasis. Cholangitis. Cholangitis is the formation. The cholangitis is just the inflammation of this bile duct. The bile duct inflammation is called cholangitis. Um, Cholangitis is the inflammation of this duct, bile duct. This is the bile duct. This is the cystic duct. This is the hepatic duct, and this one is the common hepatopancreatic duct. Now the cholangitis, in the one of the procedure that is used to screen the cholangitis, or to screen this area, to screen this bile duct, that is called cholangioscopy, in which an endoscope is used to find out some stone, to find out any anomaly inside this bile duct. That is called cholangioscopy. So cholangitis is the inflammation of bile duct. Now the coldolithiasis. Coldolithiasis is the formation of stone inside the gallbladder, or inside the cystic duct. But the coldocystitis is the formation of stone inside the bile duct. Inside the bile duct, when the formation of stone happens, this is called coldolithiasis. This usually happen due to when the stone goes further towards this area. This stone is transferred from the gallbladder towards the bile duct. So uh, this carry out the obstruction of the bile duct. So this condition is called coldolithiasis. So coldolithiasis is the formation of stone inside the bile duct. Duodenitis, the name indicates the inflammation of duodenum. The inflammation of duodenum may be due to hyperacidity, may be due to irritant, that may be due to some other factor. The next one is the diarrhea. Diarrhea is the increased peristaltic movement of the intestine, which leads to the watery stool formation, that is called diarrhea. Or you can say that more than normally, the diarrhea represent more than 10 times stool formations, more than 10 times defecation a day. Defecation more than 10 times a day, that is called diarrhea. But the watery stool formation is called diarrhea simply. The diarrhea may be due to the amoeboid infection. It may be due to some bacteria. It may be due to the sloughing of the or the eruption of the mucus layer inside the intestine. But usually the diarrhea happen due to the infection due to amoeba. So this lead to the increased peristaltic movement of the intestine. This is called diarrhea. The next one is enteritis. Enteritis is the inflammation of small or large intestine. Enteritis is the inflammation of. Usually, we use the word enteritis for the small intestine, and small intestine. So sometimes we use the word gastroenteritis. Gastroenteritis is the combined inflammation of stomach as well as the small intestine. That's called gastroenteritis. And simple enteritis mean the inflammation of small intestine. This happens due to the presence of bacteria, especially the gram-negative bacteria or anaerobic bacteria. The enteritis take place. The next one is colitis. Colitis is the inflammation of small or large intestine. Both of these show the colitis. Colitis is the inflammation of small and large intestine. This is the condition in which small and large intestine is inflamed. That may be only small intestine, that may be only large intestine. Both of these, the word colitis represent both of these intestine, but the word enteritis represent the small intestine especially. Um, this may also be due to the presence of some bacteria, some irritant, or some consumption of spicy food. The next one is constipation. Constipation is the condition in which the hard stool formation take place. This takes place when the defecation frequency increase increase less than 3 times a week. Less than 3 times a week. You know that the normal frequency of defecation should be from 3 times a day to 3 times a week. This represents the normal defecation. 3 times a day to 3 times a week shows the normal defecation process. But when the 3 times when the defecation increased 3 times a day, that's represent the mild diarrhea. But when this defecation process decreases 3 times a week, this represents the constipation in which the hard stool formation take place. Due to a decreased movement of the intestine, especially the decreased movement of the stools inside the large intestine, which leads to the dry stool formation, or hard stool formation. The next one is obstipation. Obstipation is the severe condition of the constipation. Um, the constipation usually leads to the obstipation, in which the obstipation is that type of constipation in which the obstruction of the large intestine take place. The the stool formation is so hard that it do not move inside the large intestine. That is difficult to move in the large intestine. So there is obstruction like phenomena inside the large intestine. So the constipation which shows obstruction, that is called obstipation. The next one is irritable bowel syndrome. This is generally called IBS. IBS is nowadays you can see a lot of individual in the hospital having IBS. IBS is a complex condition in which IBS represent the condition, some disease condition of the small and large intestine, both of these. But in IBS, abnormal spasm of the uh, normal spasm of the intestine take place inside the abdominal cavity. Abnormal spasm of the intestine, especially the large intestine, take place. This abnormal contraction, this in the diagram you can see, this is the large intestine. In the large intestine, overhead, this area and this area, the spasm of the large intestine take place, and this spasm lead to the some obstruction type. You can see that this spasm is very much potent. This is very potentially vigorous spasm, and this spasm lead to the condition in which there is cramping, there is abdominal cramping, there is abdominal pain, there is some condition like diarrhea, there is some condition like constipation. Then the irritable bowel syndrome, there will be abdominal pain, there will be abdominal cramps. Abdominal cramps means spasm inside the abdominal cavity. There will be abdominal pain, there will be abdominal cramp, there will be abnormal abdominal movements, there will be constipation like phenomena, there will be diarrhea like condition also, and the IBS. Nowadays the IBS is very frequent in the large population throughout the Pakistan, uh, because of the unhygienic and irregular diets of the people that lead to the irritable bowel syndrome. So in the irritable bowel syndrome, there will be uh, multiple condition, multiple symptoms. There will be diarrhea as well as constipation like condition. There will be some abnormal movements inside the abdomen. There will be frequent defecation, feeling like defecation, a lot of condition. So this is the irritable bowel syndrome. The next one is tenesmus. Tenesmus is the condition or abnormal. If there is some abnormality inside the, for example, you can see in the diagram. This diagram represent the large intestine, and this area represent the rectum. The tenesmus usually happens inside the rectum, in which the individual feel the defecation signal, in which the individual feel the signals of defecation time and again, more frequent, the frequent signal of defecation. But there is no defecation, there is no true defecation, but the individual feel the signals of defecation time and again due to some irritation inside the rectum. If there is some irritation inside the rectum, then the individual will feel like a signal of the defecation time and again. This condition is called tenesmus. The next one is fistula. Fistula is this is not a very common condition, but this fistula normally represent a condition in which there is a connection, an abnormal connection between two body cavities. When an abnormal connection between two body cavities take place, this connection is called fistula. This abnormal connection between two bodies cavity is called fistula. The most common fistula which take place inside the body um, is the vaginorectal fistula. This in the diagram you can see, this is the rectal line, this is the rectum, and this is the vaginal line. So due to some infection due to infection both inside the rectum and inside the this vaginal lining, if both of these lining showed some infection like condition, or some condition like some which lead to the injury, which lead to the ulceration and then injury, this lead to the connection between when this condition exacerbate, this lead to the connection between these two body cavities, and these two body cavities, when the connection take place, this connection is called vaginorectal fistula, or you can simply call it fistula. This can also happen between the urethra the male and the rectum, but that is very rare. This condition is not very rare, but that is very rare. And the condition in which there is abnormal, so this connection is not normal. Normally there is no connection between the rectal lining and the vaginal lining, but in the due to some this may also take place due to some injury inside the rectum during the surgical process. During the surgical procedure, and some injury take place inside the rectum, and this injury may also lead to the fistula formation. The next one is appendicitis. Appendicitis is the inflammation of appendix formiform. The appendix, appendix is the part of cecum. Cecum is the point of the large intestine where it meets with the small intestine with the ileum. So when this appendix or appendix vermiform inflame, this condition is called appendicitis. So the inflammation of the appendix vermiform is called appendicitis. This usually happen due to entrapment of some foreign matter that is containing a large number of bacteria or some other microbes. This lead to the appendicitis. The next one is proctitis. Proctitis. Proctitis is derived from the word proctology. Proctology is the study of rectum. The study of rectum is called proctology. And proctitis is the inflammation of rectum. The inflammation of rectum is called proctitis. This may also happen due to some irritation or some irritation. The large number of diseases of the small and large intestine shows some factor in common. Those are some bacteria, those are some spicy food, those are some hyperacidity, those are a lot of factors are there, but the most common factor is the hyperacidity, bacteria, some irritants, or some irritants in the spicy food or in the drugs, or some other or some other factors also. The next one is anus. Anus is the inflammation of anus. Uh, Inflammation of anus, this is called anusitis. And the next one is volvulus. Coming toward the next phase, volvulus. Volvulus is the condition in which the small intestine or large intestine, but usually the small intestine, the small, due to abnormal movement of the small intestine, there is the obstruction like condition that is called volvulus. Due to abnormal movement of the small intestine, obstruction like condition take place, that is called volvulus. This leads to the obstruction of small intestine, and this usually happen in small kids and the babies due to abnormal movement on the ground, and due to during the crawling processes. So this is one of the condition in the children, the babies. The next one is hemorrhoid. Hemorrhoid is also called file. Hemorrhoid may be internal or external. This is the condition in which the blood vessel inside the rectum or the anus, these blood vessels, these are the internal blood vessel and these are the external blood vessel. So the inflammation of internal blood vessel or external blood vessel leads to the formation of inflammation, formation of hemorrhoid or file. So the inflammation of these blood vessel or these blood vessel lead to formation of what? Due to formation of file like condition. And this condition take place due to uh, I have I have already explained a terminology in the previous lecture. mm, Valsalva maneuver. Valsalva maneuver are the straining process. If there is increased straining process inside the rectum, or when uh, when the stool formation, when the hard stool formation take place inside the intestine, the usually the hemorrhoid or the file take place in the individual who have a constant constipation, who have a constant constipation, and during the defecation process he used the severe straining. He used this severe straining. So this leads to the hemorrhoid-like condition in which the inflammation of these blood vessels, internal or external blood vessel, take place, and these the inflammation of these blood vessels lead to condition that is called hemorrhoid. Sometimes the bleeding take place inside these blood vessels, which in which the stools also show some drops of blood. The next one is colic. Colic is the next two terminology, colic and gripe. Gripe is mild abdominal pain, and colic is abdominal pain. Abdominal pain is called colic. The abdominal pain may be due to the pain in the small intestine, due to pain in the large intestine, but the gripe is the abdominal pain which is mild, which is very mild. This pain may be due to a lot of factors. I have already told you that that the intestine, the small or large intestine, or whole gastrointestinal tract needs the soft food, or the food which is to be chewed very softly, and where there should be no hard there should be no hard entities, or where there should be no no bacteria or any other factor which can lead to the irritation of the small or large intestine. So the wall of the small and large intestine is composed of large number of penicillin. The penicillin is responsible for the killing of bacteria and as many other microbes, but if the food which we take contain large number of microbes, then our body is not able to fight against all these microbes. So this lead to the some condition like irritation, and those irritation may lead to some other condition, and that leads to abnormal spasm, and this abnormal spasm may lead to sometimes you know that when inside the small and large intestine the microbial colonies are formed, and those microbial colonies may lead to the perforation of the intestine. That may lead to perforation of the intestine. So this is the most severe condition in which the microbes are in large number inside the intestine. So there are large number of medicine which we use for the relief of these conditions. We will discuss some of these in the our Google Meet session. So this was all about our presentation.